The president's health care law and all the taxes that come with it is hitting one medical device maker directly in the wallet. Cook Medical says the medical device tax means the company cannot afford to expand or hire to the tune of 1,500 workers. Pete Yonkman is the executive vice president of Cook Medical. Thanks for joining us, Pete. You were planning to add, what, 5 new plants in the Midwest, and now those plans are off the table?
Yeah, we had hoped that would sort of be our strategy for growth as we move forward the next few years. We had a plant facility that we opened up in Canton, Illinois. It was a tremendous success. Just a few years ago, we added 300 jobs in Canton, Illinois, and the community was extremely supportive, and they came out and rallied around the company. And we'd hoped that would be our sort of our model going forward. But unfortunately, we looked like we're just not going to be able to go down that route.
Now, I read that you're estimating this could cost you $20 or $30 million per year. Is that right?
Yeah, that's about right. Yep.
And what we were talking about is a 3.8% medical device tax that's in Obamacare that maybe a lot of people watching right now don't realize is even in that law.
Yeah, the new medical device tax actually is an additional tax that we hadn't had before. So sometimes people think of it as a sales tax, or they say it's a sales tax. But what it really is, it takes 2.3% of our revenue and then adds that on to our tax bill every year.
Okay, so 2.3%. Maybe I misstated the number. Okay, so $20 or $30 million, you decided not to hire the people, build the plants. Did I read that you're looking internationally, looking elsewhere to hire people and open plants?
Well, yeah, you know, we're primarily a U.S. medical manufacturing company. We have facilities in Bloomington, Indiana, North Carolina, Illinois, California. And as I said, we were hoping to add facilities here in the U.S., but as our tax burden increases and as the challenges of adding facilities here in the U.S., we're looking to add on additional resources in Ireland and some other places where we already have existing facilities.
And so, okay, so you said you've created about 300 jobs with the last time with the other plant that you refurbished and bought and refurbished. So 300 times 5, are we talking 1,500 jobs?
Yeah, that's about right. About 1,500 jobs that we had looked forward to in the next 5 years. Excuse me. We are looking to add in other facilities. You know, we're a global organization, so we have about 10,000 folks around the world. And what we have to do is look at where do we add our resources next? Where do we add people? Where do we add facilities?
Can I in order to be competitive, Pete, let me just ask you, how long in advance do you do that? In other words, if they were even to pull that tax out of Obamacare right now, would it be enough time to save those 1,500 jobs?
Well, certainly we go back and look at our planning, but you know, it takes at least 2 to 3 years to sort of to work out those plans for every facility. We started looking at Canton 3-4 years ago, maybe even 5 years ago, and it took us, and we're still ongoing adding jobs. We started with 30 jobs in Canton, Illinois, up to 100, and on our way to 300 very quickly.
All right, and it's going to cost you 20, 30. I read there's Medtronics, for example, big medical device manufacturer, up to $175 million a year for them alone. So clearly the numbers are big and putting a bit of a clamp on hiring. We're going to have to leave it there. That's Pete Yonkman, Cook Medical. Thank you, sir.
Thank you.